In the run-up to the UK election, we want to use this time to take you through our oral health manifesto point by point. We hope that policymakers take this opportunity to brush up on their oral health knowledge so that they can better equip the country with what it needs. Right now, we're going to be having a look at boosting the oral health workforce. Now, there's a few different topics within that. We're mainly going to focus on making dental schools, expanding the student places and helping people get into dental school, hoping that that will then become appealing to younger people, and also talking about the wider use of the dental team beyond just the dentist. So the first point there in expanding places in dental schools, I don't know how realistic that is, but we do know that they are incredibly competitive to get a space.
It is, yeah, it is in very competitive to try and get a place in dental school. They are going to be creating more spaces. They are creating new dental schools. This isn't an overnight fix because it takes 6 years to train a dentist. So, you know, we're not going to see the fruition of this for a little while, but every little helps, as they say. Also, we need to speed up the process of dentists from overseas that want to work in this country. So it needs to be quicker to get them registered, to get them have done, you know, the various exams that they need to do, to get them, you know, into work as quickly as possible, because sometimes it can take a number of years to get them working. This is if their qualification doesn't match the UK qualification. So, you know, they have to have a series of tests before they can work. So that is looking at dentists. And, you know, yes, we want to make it more appealing to young people to go into dentistry. And it doesn't have to be as a dentist. I mean, a career in dentistry is a lifetime career. I mean, it's pretty much all I've done is work in dentistry. You know, it's been a career for life, if you like, in different guises.
Yeah,
I mean, different guises, because there are different ways of working within dentistry without actually working at the coalface, you know, without doing that. So there are lots of different options. So I think young people, it's really important that they have a look at every aspect. You know, there are many people that make up the dental team, so we can, you know, go through them one by one and have a look at, you know, what we can, you know, get them to do, because a dentist doesn't need to do everything in the dental practice. A simple filling, if they've got a therapist, a hygiene therapist can do the fillings. There is also a hygienist who isn't a hygiene therapist but does the cleaning and the preventative advice, the dietary advice, all of those kind of things that do get rolled into the hygiene therapy role as well. Now, to be a hygienist or a hygiene therapist, you have to be a qualified dental nurse. So you can either do it via an apprenticeship or by getting a job in a dental practice as a trainee dental nurse, and then you'd go to college and do the training. You can also pass things on. You know, your dental nurse can do extra training, so they could be trained to take x-rays, which again frees up the dentist time. They can take study models, so they take impressions of the mouth, so that again frees up time. Apply fluoride varnish. They could be oral health educators, which means that they can educate and talk to people about their oral hygiene, which gives so much more time to go through things and make sure that everybody understands, you know, what is best for their mouth and what they're doing. So it's like a whole, you know, well-oiled machine. You know, that dental team is not the dentist and, you know, nobody else. Then it doesn't work like that. Everybody has their place in that team, and everybody has their different role within that team. And if we utilize the whole of that team, then we will free up more space for seeing more patients. And as I say, it is a great career. It's enjoyable, it's fulfilling, it's you know, you're helping people, and as I say, what can I say? I've been doing it for many years. I don't want to say how many years there. I could probably work it out, but I'm not going to.
You are living proof that it is a job for life, that it's an industry for life. There's
It is,
so many different things you can do, because I think you've
totally.
probably done all of them. And it's something I think that younger people, if they knew more about it, they would really gravitate towards. And because a lot of people don't necessarily know the full spectrum of what's done in the industry,
Mhm.
they just think dentist, filling, clean, that's that. They don't really think about the pure, like, artistry that some people do, like when people design like orthodontics. And I've talked
Mhm.
about how I'm absolutely fascinated by dental technicians and all the stuff they do, because that's the bit that if I was going into the industry, I would gravitate towards, because I am quite creative and physical and like to do like crafty bits. And so there's so many different areas that you can fit into. And
Absolutely.
I see also the amount of pressure that younger people are put under with exams, and just getting the grades to get the A levels that they want to go and do to be a dentist. That's incredibly difficult for some people, and it's getting harder and harder to get higher marks. Places are just getting more competitive. And so if they don't feel fully supported in that properly uphill journey, if you're not, if, let's say you're an average person in a state school and you're in a fairly average school at that, way, 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 way more challenging than if you are privately educated, can afford to get the help to study for these exams that are very,
Mhm.
very difficult to get places in. And it's an you've got to be very, very determined. And if you just have a bad exam, that's it. That's your chances gone, because
Mm.
that's unfortunately the
So
how
it's a very
it works.
sciencey subject, isn't it? Science
Yeah,
and maths you need to have, which is why it's great to have other parts of the dental team that you perhaps don't need to have such high expectations of your A levels. If you want to be a hygienist or a hygiene therapist, what you do is you start as a dental nurse, you qualify as a dental nurse, and then you go to university to study to go on to those other roles. So that is another way in, because, and I think it's a great way because you've actually worked in dentistry. You understand how a practice works. You understand patients' needs. You understand the anatomy of the mouth. You know, you've done that in your dental nursing qualifications. So then you can quite happily go off um, to train some more. And I think that's great. That's a great way of upskilling our team. However, we need lots of dental nurses. Dental nurses are
they are
really,
brilliant. We love them. We love a dental nurse. We do.
she has to say that, doesn't she?
I
Because I'm
do.
sitting here. But yeah, they are um, getting quite rare, people who stay in dentistry. And I think that's partly because it is a hard job, and sometimes they don't get the recognition that they're due. Um, so big up the dental nurses. We love them. But definitely, I think we need to make sure that the whole team is on board, and then we can meet the whole of the population's needs all in one
100%.
place, one-stop shop.
Read the full manifesto on our website and get in touch with your local counsellor to see what they're planning to do to improve the oral health in your area. For our last episode next time, we're going to have a look at improving costs of NHS dentistry.